Welcome to Lecto. Today we are going to discuss anti-tumor antibiotics. This is the second category of the anti-cancer drugs. In the previous lecture we discussed the anti-metabolites. But today we are going to discuss anti-tumor antibiotics. Actually you will see the three categories of the antibiotics. First one is the anthracycline, second one is the bleomycin, and third one is the mitomycin. So if you see here in the anthracycline, you will see further different drugs: Doxorubicin, Daunorubicin, Idarubicin, Epirubicin, and Mitoxantrone. So these are basically the five categories that actually fall in the anthracycline. So in this lecture, we will specifically discuss this first category, that will be the anthracycline. Okay. So our main focus in the anti-cancer drugs will be the destructions of the tumor cells. So we can destroy the tumor cell if we stop the dividing of the cell. So if you see here, like this is the cell cycle in which you will see the four most important phases: G1 phase, S phase, G2 phase, and the M phase, that is the mitotic phase. Okay. Two most important terms you have to remember. First one is the cell cycle specific drugs. Okay. And second is the cell cycle non-specific drugs. So actually there is a difference between how different drugs, specific and non-specific, will act in the dividing and the non-dividing cell. So when the cell have to divide, they go through the cell cycle from the G1, S1, G2 and M phase. So this is the phases in which the cell will divide. So when we talk about drug cell cycle specific drugs, it means that these types of drugs will act on the dividing cell. So these types of drugs will act on the dividing cell. Okay, this is the one thing. But the cell cycle non-specific drug will act both in, doesn't matter the cell is in dividing or the non-dividing phase, it will act on both cells, dividing or you can say non-dividing. Okay, so these are basically the non-specific. It doesn't specific to either dividing or non-dividing, but the specific drugs is specific only when the cell are in dividing phase. So when the cell actually are in dividing phase, it means that the cell will go through all the four phases. It means the cell may be in the G1, S, G2 and M phase. But when we say that the cell are not in dividing phase, it means that the cell actually present in G0 phase. This is actually the resting phase, or you can say non-dividing phase. It doesn't mean that the cell always will remain in the G0 phase. It can reverse into the cell cycle. But there are some cells that always remain in the G0 phase. Okay. But anthracycline actually fall in the cell cycle non-specific drugs. It means that these drugs will act on both dividing and the non-dividing cell. Okay. Next, if we move further, then if we discuss the mechanism, so anthracycline, if we discuss specifically the doxorubicin. So an enzyme that is most important is the cytochrome P450 reductase. That is cytochrome P450 reductase. In the presence of this enzyme, doxorubicin, you see doxorubicin along with the oxygen, if you will see the reaction between the doxorubicin and the oxygen in the presence of the cytochrome P450 reductase. Doxorubicin will convert into the reduced product. Okay. because this enzyme actually reduce the doxorubicin. And next you will see the two most important, you will see the productions of free radical species. You see the superoxide and the hydrogen peroxide. So these are basically the free radical species, and these free radical species are dangerous to different factors. Okay, first if you see, like, these free radical will act on the DNA. So actually they will act on the DNA and break the strands of the DNA. So this is the first functions of the free radical. Second function of these free radicals, they will actually oxidize the lipid peroxidation. Actually you will see the cell membrane having lipids, and these lipids actually go towards the lipid peroxidation. Okay, when you will see the lipid peroxidation, that it will damage the cell. So free radical act on the DNA and destroy the DNA. Second is the lipid peroxidation, and these factors, when you will see the destruction of the DNA, when you will see the destructions of the lipid membrane, or you can say cell membrane, then ultimately the cell will destroy. Our main focus is on the destruction of the tumor cell. So it means that these drugs are working in the destructions of the cancer. Okay, next, these drugs, another function is the, like, suppose if I say, like, this is the doxorubicin. Doxorubicin will actually intercalate between the nitrogenous bases. So actually these drugs will intercalate between the nitrogenous bases of the DNA, and that will ultimately, you will see the DNA become non-functional. If the DNA become non-functional, then you will see there is no message from the DNA in the division of the cell. So ultimately the cell division will stop, and ultimately we can cure the cancer. Okay, another most important thing, these drugs can also inhibit the topoisomerase 2. So when this enzyme block, that is actually involved in the transcription and DNA repairing and DNA replication. So when this enzyme block or inhibit, then you will see ultimately there is no division of the cell. So basically three most important mechanism. First one, productions of the free radical. Second one, intercalation, and third one is the inhibition of the topoisomerase enzyme. If we discuss the clinical use, no doubt all these drugs, doxorubicin and these 5 drugs, have similar structure, similar mechanism of actions, but their therapeutic, or you can say clinical uses, are different. So if we first of all discuss the doxorubicin. Doxorubicin, if we discuss, are used in the Hodgkin and non-Hodgkin lymphoma, both in which we see the Reed-Sternberg cell in Hodgkin lymphoma. So Hodgkin plus non-Hodgkin lymphoma. This is the one case. Second, you can also use doxorubicin in myeloma, multiple myeloma, and you can also use these drugs in the blood. That will be the B stand for breast cancer, lungs cancer, ovarian cancer, and the thyroid cancer. So these doxorubicin can also use in these 4 types of cancer. Okay, next if we discuss the Daunorubicin and the Idarubicin. These drugs actually use in the acute leukemia, both types of acute leukemia. If you see here, these 2 drugs actually use in acute leukemia. So both type, AML and the ALL, acute myelogenous leukemia and acute lymphoblastic leukemia. So both these 2 drugs can be used in both leukemias. Next is the Epirubicin. So this drug is actually used in the breast cancer and the gastroesophageal cancer. So these two most important cancers. No doubt these used in other cancer as well, but these are most specific. Mitoxantrone actually used in the AML, specifically AML, acute myelogenous leukemia, and these drugs can also use in the non-Hodgkin lymphoma, and both breast and the gastroesophageal. Breast and the gastroesophageal cancer. So these are basically the three most important: AML, non-Hodgkin, and the breast and the gastroesophageal. If we discuss the adverse effects of the anthracycline, then first of all, most important is the bone marrow suppression. Okay. And if you can also see the different NVD, nausea, vomiting, and diarrhea. So this is the in majority cases when you use the anti-cancer drugs. So these three most important: diarrhea, nausea, and vomiting, NDV. These are the most important or most common symptoms when you use the anti-cancer drugs. Next is the alopecia, loss of hair. That is another symptoms, adverse effects. And you can also see the GIT distress when you use the anthracyclines. Okay. You can also see the coloration, red colorations of the urine when you use the anthracycline, specifically Doxorubicin and Daunorubicin. So this is another important thing, red coloration of urine. Okay. And last, most important, when you use the specifically again Daunorubicin and Doxorubicin, cardiotoxicity. So cardiotoxicity, that is the most common adverse effects of the anthracycline. So when we use the Doxorubicin, let's suppose when someone takes Doxorubicin, then it is contraindicated to take the trastuzumab along with the Doxorubicin. So it is because you will see the cross reactivity. So Doxorubicin will not be taken along with the trastuzumab, because in this case when we use the trastuzumab along with the Doxorubicin, it goes towards the cardiac failure. So it is inhibited when we use the Doxorubicin along with the trastuzumab. Okay. Because Doxorubicin causes severe cardiotoxicity. So we have two options to reduce the cardiotoxicity due to the Doxorubicin. First one, we can take the desoxyribonucleic that actually inhibit or reduce the cardiotoxicity that is caused by the Doxorubicin. So we can take the desoxyribonucleic. So desoxyribonucleic actually reduce the cardiotoxicity that is caused by the Doxorubicin. And second is the modified form of the Doxorubicin, that is the liposomal encapsulated Doxorubicin. That is actually the alteration or modification in the formulations of the Doxorubicin that also cause the less cardiotoxicity. So these are basically the two options. When we use the Doxorubicin, you will see the cardiotoxicity. So you have two options to reduce the cardiotoxicity. First one, you will see the desoxyribonucleic, and second is we can use the liposomal formulated of the Doxorubicin. So this is all about the anti-cancer drugs, specifically anti-tumor antibiotics. If you have any question, you may ask in the comment section. Thank you so much.